Nurses are found at every stage of the patient experience, from birth all the way to the end of their life. This job is about being there throughout that entire process and having a strong sense of altruism for others, their well-being, and their success.
The reason I want to be a part of the healthcare team is because you get to make a real difference in the patients' lives and the people you interact with.
You're not going to learn nursing just by looking at books. You just can't. Having the skills lab to kind of get our feet wet with how to do the skills, but then having the sim lab, which gives you a simulation of patient care.
Where you get to look through their chart, look at their medications, what you're going to probably need to do, and then you come in and you're kind of thrown into a clinical situation, but it's a safe learning environment where you are able to work with other nursing students and your professor and ask questions, and it's a safe place to make mistakes because we are students and we are learning. And then we also have the meeting afterwards where we go over what happened, what we did, why we did it, and then also looking at what we could have done differently to learn for the next experience.
The students and the faculty and the staff and the people who are our clinical coordinators and all of that stuff, we are all together, and what we have in common is nursing. But also everyone is either here to get an education or here to support you in attaining that education. And they go above and beyond to help us become the nurses that we're supposed to be.
The student nurse organization here at Missouri State is for nursing students as well as pre-nursing students to come together and connect to the Springfield community and go out and do service activities. We really encourage volunteering for our members.
And so at the pinning ceremony, they receive their pin for being in the program, but then they also will receive their cord if they were an active SNO member. It's not a graduation ceremony, but it is, because you're exiting your cohort, you're exiting your program, but it's more of a celebration that you're becoming a nurse. And it's about being on a team and being together. It's a community. It is not a solo sport at any point in your career.
The possibilities are endless with nursing, and that's something I really like about it.
Nursing is service. It is serving the community at their most vulnerable.
A lot of times you're working with people on what is the worst days of their life.
Someone comes to you as a nurse, and whether it's in long-term care or whether it's in a clinic, they are coming to you because they need help.
I really enjoy getting to help them and work towards their goal of getting better and get to see that. That's what nursing is to me, and that's how I find satisfaction in what I'm doing.
All nursing is just helping them get to a point in their healthcare journey that is stable and good. For lack of a better word, it's helping people. It's community service, lifelong.